Welcome, and thank you for viewing Understanding the Urinary Tract Infection Quality Measure. This presentation is one of the series of videos explaining the quality measures that comprise the Nursing Home Quality Measure domain of the Care Compare Nursing Home 5-star rating system. You may find it useful to have a copy of the current quality measures user's manual turned to the long stay percent of residents with a urinary tract infection quality measure page when viewing this video. The link to that manual is found on the next slide. MDS 3.0 Section I is also included in this quality measure. This presentation contains information from the MDS 3.0 RAI manual and the MDS 3.0 Quality Measures User's Manual version 14, accessed in July 2021. This presentation is meant to enhance understanding of the quality measures discussed during the presentation. It is not meant to take the place of or be all-inclusive of information and instructions provided by the MDS manuals. Any updates to both of these manuals will supersede content presented, and the most current manuals should be utilized at all times. The links to the official CMS site providing MDS 3.0 and MDS 3.0 quality measures materials are provided on this slide. During this presentation, I will refer to the target assessment, which is the reason for the MDS assessment. The federally required OBRA assessments are completed on admission, quarterly, annually, and with a change in condition or a significant correction to a prior MDS assessment. Admission assessments are not included as target assessments for this QM. For OBRA assessments, MDS item A0310A is coded as 2, 3, 4, 5, or 6. Another reason for a target assessment may be a discharge assessment. The discharge assessments considered for this quality measure are those coded as 10 or 11 in item A0310F, return not anticipated or return anticipated. PPS 5-day assessments are not included in this quality measure. Each of the MDS assessments has a target date, also known as the event date of the MDS record. The first type of record is the entry record. The target date for the entry record is the date the resident entered your building. For discharge records, the target date is the date of the resident's discharge. The discharge record is coded as a resident whom you are not expecting to return, or as a resident you are anticipating to return to your facility. Deaths in the facility are also coded as a discharge record. For discharge records, the actual date of discharge or death is coded in item A2000. For any other assessments, such as OBRA required admission, quarterly, annual or significant change in status, or the PPS assessments, the target date is the assessment reference date, sometimes called the ARD. The ARD or target date is the last day of the resident's observation period and is MDS item A2300. For example, if an item on the MDS has a 7-day look-back period, the information collected for the 7-day period will end on the ARD at midnight. For each of these target dates, you will want to make sure that you include anything that occurs on that date up until midnight. The urinary tract infection quality measure is a long stay quality measure pertaining to residents who have been in your facility for 101 days or more by the end of the target period, as we discussed on slide 4. A resident must be in your building for at least 101 days to be included in the long stay measure. A couple of points to keep in mind is that only days within the facility count in the 101 days. When calculating cumulative days in the facility, or CDIF, the day of entry counts, but the day of discharge does not. However, if a resident is admitted or readmitted on the same day as they are discharged, then the resident is counted as having a 1-day stay. Now that we've discussed some important definitions, let's take a look at the urinary tract infection quality measure more closely. On the CASPR report, the numerator is the actual number of residents who were impacted by the quality measure condition during the report period. This example shows that one resident is included in the numerator as having a urinary tract infection during the target period. To be included in the long-stay urinary tract infection numerator, the resident's MDS is coded as having a UTI during the look-back period of the target MDS assessment. This is documented at MDS item I-2300. Pay close attention when coding this item because the UTI diagnosis has a 30-day look-back period. This is a unique look-back time frame in the MDS active diagnosis section. On the Casper report, the denominator is the number of residents potentially impacted by the quality measure condition during the reporting period. So in this example, 50 residents are part of the denominator because they could potentially have had a UTI. For the long-stay urinary tract infection quality measure, all residents who have had a stay at your facility 101 days or more with a selected target assessment are as discussed on slide 4, are included in the denominator unless they have an exclusion. Exclusions are certain conditions that will exclude a resident from being counted in the numerator and the denominator. There are 2 conditions where long-stay residents are excluded in the long-stay urinary tract infection quality measure. The first exclusion are residents for whom you are doing an admission assessment or a 5-day PPS assessment. Because of the 30-day look-back period, the infection could have begun long before the resident was in your care and be the result of circumstances outside of your control. This prevents this type of situation from counting against the facility in the quality measure. The second condition is where the long-stay resident's MDS is coded as not being assessed for a urinary tract infection in the last 30 days during the target assessment. In this case, there is a dash in the box where the UTI diagnosis is coded. I want to caution you about using dashes. When a dash is used, it indicates that the item was not assessed. The most common use of a dash is when a resident is discharged or dies before the item could be assessed. Dashes should not be used routinely, and they can affect your quality measures by reducing the size of the resident denominator, causing an increase in your facility percentages, resulting in an inaccurate picture of your nursing home residents or quality improvement efforts. The MDS manual provides coding instructions and tips for accurate and proper MDS coding. I encourage you to review the MDS manual frequently, as the volume of instructions and special circumstances cannot be committed to memory for coding all of these MDS items. Rather than the usual 7-day look-back period for section I, the active diagnosis section, a 30-day look-back period is used for coding UTIs. The MDS 3.0 RAI manual gives 2 specific criteria that must be met for a UTI to be coded. First, it must be determined that the resident had a UTI using evidence-based criteria, such as McGear, NHSN, or Loeb, in the last 30 days. Be aware that the facilities are expected to use the same consistent, nationally recognized criteria for this evidence base for their infection control program. You cannot change the criteria with each resident. The facility must choose a criteria and stick with that. And second, there must be a physician-documented UTI diagnosis or by a nurse practitioner, physician assistant, or clinical nurse specialist if this is allowed under state licensure laws. And this has to have been coded in the last 30 days. A UTI should only be coded on the MDS if both criteria are met during the last 30 days. If the diagnosis of UTI was made before the resident's admission, entry, or re-entry into the facility, it is not necessary to obtain or evaluate the evidence-based criteria used to make the diagnosis in the prior setting. The MDS 3.0 RAI manual, section I, also addresses residents with colonized MRSA. We encourage you to read the recommendations regarding MRSA and antibiotic stewardship in the current manual. Evidence-based UTI criteria resources are also provided. The CDC has infection prevention and infection control guidelines for long-term care that can be found on their website and are linked on this slide as well as within this section of the RAI manual. At least monthly, you should be reviewing your UTI QMs with your interdisciplinary team, keeping alert for improvement opportunities. When looking at your CASPER facility level report, pay special attention to those QMs that are starred in the far right column labeled Comparison Group National Percentile. The star indicates that the facility's rate for this quality measure, in this instance UTIs, is greater than 75% of the skilled facilities in the US. In other words, 75% of the nursing homes in the country are doing better in this measure than your facility, and therefore you should work on trying to improve this QM. Also, on the CASPER facility level report, you can see the columns that show the comparison state and national average rates to compare your home status to the rest of the state and the nation. Again, if your rates are higher than those rates, this might indicate an area in need of improvement. The MDS 3.0 RAI manual directs that, in accordance with requirements at 483.80 (A), Infection Prevention and Control Program, the facility must have established routine, ongoing, and systematic collection, analysis, interpretation, and dissemination of surveillance data to identify infections. The facility's surveillance system must include a data collection tool and the use of a nationally recognized criteria. Using your data collection and tracking tools, explore trends in your facility related to infections, such as isolated locations within your building or caregivers that may be contributing to the spread. Provide education facility-wide to staff, residents, and families regarding UTIs and appropriate antibiotic use. We've provided a link to a sample handout. Not all infections need antibiotics. Look at your CASPER to resident level reports also at least monthly. Do these match up with your infection data collection and tracking tool logged as where you're aware of UTIs over the last 30 days? If someone appears on this list that you do not think meets the criteria of a urinary tract infection, as outlined in the MDS 3.0 Quality Measures User Manual, look at the coding section in Section I in the Resident's MDS. Is there an error? Are both criteria met as required by the RAI manual? These criteria include the diagnosis of UTI is determined using evidence-based criteria, such as McGeer, NHSN, or Loeb, and there must be a physician-documented UTI diagnosis in the last 30 days. We encourage you to provide education to and in support of critical thinking in nursing staff regarding concerns about suspected UTIs to encourage monitoring status, encouraging hydration, and improve perineal care through resources like the AHRQ Suspected UTI SBAR Toolkit, linked on our slide, and assure that communication is happening between all shifts to keep everyone up to date and to provide consistent care. We have provided you with an MDS coding tip sheet for the urinary tract infection quality measure. Provide this tip sheet to all staff who complete this section of the MDS. This tip sheet is available with this video as well as on the Great Plains Quinn Nursing Home webpage as linked on the slide. There are several resources that you can access to assist you with this when working on quality measures. We've provided the State Operations Manual link for review of the rules and regulations related to UTIs and to be aware of what the surveyors are looking for. In addition, the CMS policy and memos can provide documentation of any changes to the regulation. Percent of residents with a urinary tract infection quality measure is a publicly reported quality measure on the CMS Care Compare website, formerly Nursing Home Compare. Use this website to review what consumers see regarding your nursing home and the quality measures. In addition, you can see how your nursing home compares with nursing homes in your city, region, state, and nationally. The Great Plains Quinn QIO Nursing Home webpage also provides many tools and resources and links to past training events. Contact your state's Great Plains Quinn Nursing Home contact for more information or technical assistance concerning the urinary tract infection QM or any of the nursing home quality measures. Thank you for taking time to learn more about the long stay percent of residents with a urinary tract infection quality measure, and for all you do in improving the quality of care to your residents.